Very briefly, there are two categories of medication in ADHD, the stimulants and the non-stimulants. And although there are two different types of stimulant, methylphenidate and dexamphetamine, there are a number of different preparations, some long-acting, some that last like 14 hours or more, and others short-acting, 3 hours. Obviously, one needs to dose them differently. When you're starting someone on medication, you generally should start low and go slow. This population is very sensitive. So starting low means that they'll notice something sometimes they won't notice anything, but it will dwindle. They'll say something like, oh, I had a few side effects and then I noticed the benefits, but after a week and a half, it sort of went away. That's normal. That's because you're titrating it up. You're waiting to try and find that sweet spot. And prescribing is a bit of an art in ADHD. You're trying to go up without going too fast or too slow in order to find the sweet spot. Sometimes you need to go too high in order to drop back. Once on that journey, it will be very common for people to say, it started working, but it didn't carry on working. It's because you're not there yet, usually. Very rarely, people come back after years, months or years and say, the medication was working, but it's not working now. If they do, it's usually a sign that something else is going on. They've got depressed, they've got an anxiety disorder, something else is playing out, they're using substances, they're taking their meds more than prescribed and developing tolerance. The idea with stimulants is that they wear off in the evening and there is a nighttime washout. That is there to protect against tolerance. Tolerance means you need higher and higher doses to get the same effect. I rarely see tolerance in clinical practice, but I do things properly and I follow up my patients carefully and I'm alert to other things that might be going on.